Coming up in our next presentation, we have Dr. Tan Ye Hong, a urologist practicing at Mount Elizabeth Hospital. Dr. Tan has a special interest in minimally invasive surgery in the treatment of urological cancers and performs various advanced laparoscopic and robotic procedures. Today, Dr. Tan's topic will be on robotic surgery in cancer, evolution or revolution. Dr. Tan, please. Dr. Tan,
Hello.
stage is all yours.
Thank you. Good afternoon, ladies and gentlemen. I thank the organizer for inviting me to share the experience of robotic surgeries in cancer. So I think in this afternoon, I want to just touch upon some robotic surgery in cancer and what is the revolution and what is the revolutions in prostate cancer. So I will give you overviews of the timelines of current applications, diagnostics and therapeutics, and urology, prostate cancer, and kidney cancer, and other applications, and what is the futures of robotic surgery. I think in terms of surgery, I think that you probably have noticed that in the last few decades and things like that, there's revolutions in surgery. I think in the 100 years ago, I think mainly do open surgery. With the introductions of antibiotics, antiseptic surgery, all these have changed the surgery field. And in the 60s onwards, we start to see the emergence of laparoscopy, minimally invasive surgery, and in the late 90s, then we start to see the emergence of robotic surgery. And then in the 2000s onward, we also see some natural orifice, transluminous endoscopic surgery. So in the last 30 years or so, I think robotic surgery become more common since the first operative device was introduced back in 1985. If you look at the timelines on the slide itself, I think one of the first robotics application was using Puma's 560s for robots to do a brain biopsy under the CT guidance. And subsequently, we also use probots to do a prostate surgery for benign cases, and even we have robot dogs to do the hip replacement. But not until about 1996 or 97, the introductions of the new robots by Intuitive, I think Da Vinci, that become very commercially successful machine. I think the robotic surgery, I think, is different from the conventional laparoscopy as in general surgery, which is different is that the surgeon can sit comfortably on the console and operate the robotic arm from the control panels. And if you look at the slides itself, I think the robotic surgeries using the Da Vinci platforms, I think the surgeon can sit on the console and look through the console. You can have a 3D camera, very good depth perceptions, and the wrist can be controlled using the surgeon hand and can mimic the surgeon hand, but the advantage is that it can even do 360 degree. So compared to the open and laparoscopic surgery, I think robotic surgery do have a certain advantages. The robotic arm have a 7 degrees of freedom. There's no tremor when the surgeon operates. There's motion scaling, 1 to 2, 1 to 3, and there's also options of doing telesurgery. And the 3D visualizations help the surgeons do better as compared to a conventional 2D laparoscopy. But there are some disadvantages of robotic surgery at this point in time. Cost is the issue. There are some learning curve. The surgeon need to train, and also there's lack of touch feedback and things like that. But this, I think, there are certain improvement progress that to make touch available to the surgeon in future. So one of the things that as a surgeon, I think that robotic platform has made the things easier for other surgeons doing laparoscopy. I think it's just like an automatic car. It's easier to drive compared to the manual car. So more people can drive. Same thing as that more surgeons can use a robotic platform to do minimally invasive surgery. And also, because you can sit on a console, operate on patients at a prolonged hours, I think this can help us to extend our surgeon life, especially for us in the in our this part of our career. I think the objective of the cancer surgery, I think it's important to have a good cancer clearance, good oncology outcome. Whenever possible, we try to preserve the organs and there's preserve the function. And more importantly for patients, that they can have a faster recovery to back to their own life. So robotic surgery do provide these advantages, smaller scar, less pain, less blood loss, and quicker return to the normal activities. There are certain rules of robotic surgery in cancer. One, diagnosis. Two, tumor removal, organ preservation, and reconstruction. First, I would like to touch upon the diagnostic rules. I would like to use prostate cancer as an example. If the patients with an elevated PSA came in with an abnormal MRI, conventionally we'll do a transfractus, non-targeted systematic biopsy, but as illustrated in this diagram, we can miss a lesion on the prostate. So with the introductions of MRIs, ultrasound fusions, targeted biopsy using the robots, this has eliminated or minimized the risk of missing a significant cancer. So what we do during the MRI ultrasound fusion is that we use the MRI pictures and combine with the intra-op real-time ultrasound, and we combine the two images together and fuse it. Like in this picture, and we can do a targeted biopsy using the fusion's image. Okay. In addition, we also can do a systematic biopsy. So this is one of the robots that are being developed actually in Singapore. Initially, it's the Singapore General Hospital, Biobot Monisa. We use robots to positions, automatic positions. So we put in the transfractal probes, and then we can do a transperineal biopsy as compared to the conventional transfractal biopsy and minimize the risk of infection. And we have a fusion software and do elastic fusion, and then we just can do the biopsy just through 2 puncture points. And in this cartoon, you can see that the region of interest can be biopsied accurately using the robotics localization arm. So for tumor removal, I would like to use a prostate cancer example. Most of the localized prostate cancer now, other than being treated by radiation, can be treated with surgery. I think nowadays, majority of surgeons locally, are using Da Vinci robots to remove the prostates.
Remarkably clear, three-dimensional
I think with the robots, with the 3D, with a better image, I think that we can do a nerve sparing radical prostatectomy. I think preserving a better nerve supplies to the patient. They have a better functional outcome in terms of erectile erection preservation and also continence.
Spare these very delicate structures, utilizing the articulating Da Vinci instruments and a highly magnified 3D view of
so
the
basically,
anatomy
like in these
provided by the
illustrations, that we do a nerve sparings,
This added
and we
control
remove
and
the
precision
prostates,
may assist
and then
the
we join
surgeon
together.
in preserving the anatomy necessary for urinary continence, as well as the nerve bundles responsible for erections. Once the prostate is cleanly detached, the prostate is then removed through a small incision. The bladder is reattached to the urine channel over a catheter.
So we do anastomosis and
This
over the
catheter is
catheter.
left in place for a short period of time to ensure proper healing.
As compared to the open surgery, I think robotic
The
surgery has
surgery is
made this
completed with the
anastomosis much
removal of the
easier.
instruments
So
and
the
the closure
wounds
of
are
the
quite
small
small,
incisions in the abdomen.
and the patient can recover faster.
Prior
So I think systematic review and meta-analysis have confirmed that he has a better overall outcome as compared to traditional opens or laparoscopic surgery in terms of blood loss and transfusion rate. And with nerve pairings, I think the erectile functions is better preserved and also less urinary incontinence. So in terms of oncology outcomes, I think study have shown that the 10-year outcome cancer survivors is comparable to open surgery. I think robotics surgery for prostate cancer is here to stay. So organ preservation is another indication for robotic surgery. We use kidney cancer as a illustration. With the robots, we can do a keyhole operation. In this case, a cartoon will show that a tumor in the mid pole that can be resected. We mark out the tumors, and subsequently we clamp the vessels. Then we excise the tumors. I think one of the advantages of robotic surgery in this case is that because the risk of the robotic things that can be manipulated, so that it make the excisions much easier, and also for reconstructions, I think the suturing is much easier as compared to the conventional laparoscopy. So like what I mentioned earlier on is that with the robotic platform, more surgeons can do a partial nephrectomy as compared to a conventional laparoscopy, which is technically more challenging. So robotics surgery have allowed us to do a more complex tumors. I think we can do a higher tumor, bigger tumors, and with a lower surgical morbidity and better preservations of function. So another advantage of robotic surgery will be an area that is difficult to access, like back to the mouth, throat, the voice box, tongues, the conventional instruments is difficult to access there, even with human hands. So one of the things that that robotic surgery can be used in selected head and neck cancer, hypopharynx cancer, oropharyngeal cancer, base of tongue, and tonsil. We can use a transoral robotic surgery. In this case, you can see that there's a tumor at the base of the tongue, and then with a robotic surgery, you can excise it. I think in the conventional open surgery, I think it's not easy to access this area. And then for the patient, I think the advantage of it also less of cosmesis deformity. So robots, I think traditionally use multi-ports, but with the introductions of a new robotic machine with a single port surgery can be done. Although this is not available currently in Singapore yet, but they are available around the regions in Hong Kong and in the US. So you can see that with a single port, you can put multiple instruments, and the surgeon can control the cameras and the instruments to excise it. So I think this is something that we have to look into it to minimize even the morbidity to the patients. So these are examples of the single ports prostatectomy for prostate cancer. So you just go through umbilicus and can remove the prostates. This is an example of a partial nephrectomy using the single ports robotic platform. So there are many other applications that can be used in ENT, pediatrics, neurosurgery, and they are here. There are many more applications that we can explore in the future. So looking at the scenario, I think in Southeast Asia, there are many robots that are being installed. For the Da Vinci robot, Singapore has 10, while our competitor up north in Thailand, they have 12. I think this is something we have to bear in mind, the competition around the region. In Singapore, what are the urology cases that we use robot? Majority of them was prostatectomy, followed by partial nephrectomy. We also use it for cystectomy, adrenectomy, and nephrectomy, although this indication is a bit less. And then how about other disciplines? Majority are still used by urology in Singapore, but followed by general surgery and gynecology. But worldwide, if you look at it, other than gynecologists and urologists, I think more and more general surgeons are using robots to do this operation. So when you look at the markets, this is the multi-millions markets. And then if you look at it, more than 6,700 Da Vinci machine has been deployed worldwide. And to date, more than 10 million procedures have been done using this machine. So you look at it, it's that by 2025, the market is probably reaching about 7 billion. So definitely, I think surgery has come in a long way from freehand surgery, minimally invasive surgery, robotic surgery, and going forwards, I think probably is automatic robotic surgery. Even you look at the Da Vinci robots, they have evolved over the years. There's network connectivities, better visions, and better simulations, and advanced visions, and then the data analysis. So with the robots, I think one of the advantages is that you can use it to do it remote surgery. Technically, we can sit here in this room and operate across the world to the UK. I think it all depends on the internet connection and things like that. Of course, there are also ethical issue, legal issue, who is going to be responsible, the surgeon who operate on the robots remotely or the assistant at the operating theater at the point in time. But this is something that is come. So there are newer robots coming in the markets. Hopefully they can drive the cost down. This is a Titan Medicals. I mean, it just looks like a computer chair, computer games. I think my son will be a better surgeon than I do in the future. And newer robots like CMS, you can use 3D glasses and an open platform, and then you can just do the operation. There are many other modular robots are coming to the markets. Hopefully, we have a better choice. So if you look at in the past, we only had a patient, we use simple instruments to do the operation, and then currently we can operate with robots, with certain device, but in the future, with the artificial intelligence, augmented reality, I think we can do the operation even better. But I have to emphasize that robots are just new tools to allow us to do things faster, more accurately, and more safely. The robots provide us a 3D image, but 3D does not mean that we are better surgeons. So you give me a Ferrari, does not mean that I'm a better driver. I think it's important to know that the tools matters, but the surgeons matter most. I think it's very important to have a good surgical experience and good surgical techniques. And in conclusion, I also have to emphasize that robot is just one thing, but the principles of cancer surgery remain. I think as a surgeon, we have to do multidisciplinary consult to ensure good cancer clearance, good oncology outcome, and preserve the function if possible, try to preserve the organ, and finally, I think good recovery for the patient. Thank you.
Thank you very much, Dr. Tan. Look forward to hearing from you for our panel later on.
Thank you.